Are you considering tracheal shave surgery to reduce your Adam's apple? Let's talk about what can potentially happen. While this surgery can create some beautiful results, the neck has a lot of delicate structures in it that can create some potential problems. Hi, I'm Dr. Sarah Saxon, double board certified facial plastic surgeon, and I specialize in facial feminization, which includes tracheal shave surgery. So whether you're in the early stages of research or already scheduled for your surgery, this video will be useful for you to make your journey as smooth as possible. So tracheal shave surgery, or otherwise known as Adam's apple reduction, is actually a surgery with the least downtime that I do. And so it's one of those procedures that you can do one day and probably be back to work within a couple of days, even though you may have kind of a sore throat, maybe a little swelling, a little soreness. But for the most part, you can get back on your feet very quickly. It's a short procedure. It takes me about an hour, and I do this under general anesthesia, so you're fully asleep while you undergo the tracheal shave surgery. One thing that can happen with any procedure is infection. Anytime we make an incision in the skin, this can happen. This is why I put you on a light antibiotic for the week while you're recovering. I also use a needle that I poke through the cartilage during the procedure, which goes into your airway, so that can seed some bacteria in the surgical wound. But as long as you're taking your antibiotics, I've never actually seen an infection after this surgery, so the risk is very low. Another potential complication of trach shave, like any other procedure, is scarring. I make the incision underneath where your neck bends, right here, so it's well hidden. It is about 2 centimeters in length. I'm able to stretch the skin down below, right where the bump is, so that we don't make an incision right over where the Adam's apple is. That would be a lot more obvious. The incision does stay pink for several months, and if you're lifting and lowering your neck a lot, that can put some tension on the incision, so it can thicken. I have had some incisions that I've had to inject steroid into here because of that. I leave long-acting deep sutures that take about 3 months to dissolve, and that takes tension off the incision. I find that's very helpful. You can do things like microneedling or laser treatments after surgery to minimize the appearance of a scar, but in general, most people aren't bothered by the scar at all. One major thing that I look for after surgery, and this usually happens within 24 hours if it does happen, is fluid collections, either a seroma or hematoma. And anytime you have an empty space in the body during surgery, your body wants to fill that space with fluid. And whether that be clear fluid, which is a seroma, or blood, which is a hematoma, because this area is right around your airway, that can pose a potential problem. So if enough fluid gets in that area, it can actually compress your airway. So I like for you to be in town at least 24 hours, especially if you're, live 2 to 3 hours away. I'd like for you to stay overnight so that we can keep an eye on you. And as long as you're okay the next day, you're good to go home. I've actually only had one patient who's ever had a seroma, and it's one person that had a lot of coughing when they woke up. With this procedure, we tend to remove the breathing tube while you're still fairly sleepy, and that way it doesn't trigger a response for you to cough or have any kind of irritation in your voice box. And so with that being said, it's very rare, but possible. One thing that I can see after a tracheal shave surgery is muscle tension. You have some muscles that go up and down here called the strap musculature of the neck. And I have to push these muscles aside to get to the cartilage that forms your Adam's apple. Once we're finished with the procedure, I actually stitch those muscles back, kind of like a corset, and that gives a nice layer of muscle between the cartilage and the skin. Because if I don't do that, the skin can adhere down to the cartilage and create a little tether point. So when you're swallowing or talking, as your voice box moves up and down, it can actually form a little area that tethers and shadows right here. So if that happens, it's not the end of the world. We can go in and do something called subcision, where I take a needle and break up that scar tissue. We can also inject either fillers or fat in that area to give a little cushion. between the skin and the cartilage there. If you have a lot of muscle tension, that can create some strain and pain in your neck, especially if you're using your voice a lot to work or if you're a singer. And some of that muscle tension can also affect your vocal range until it softens up over time. So, again, if you're a singer, your range may be affected, but once those stitches dissolve and once things settle down over the first few months after surgery, you should go back to normal. Any of my patients that aren't hyper aware of their voice, if you're not using your voice a lot, if you're not a singer, it's usually not bad enough to even be bothered by. So it's just those that use their voice a lot that they will notice a change. And speaking of voice changes, one of the main potential complications of tracheal shave surgery is permanent changes to your voice. And that's because the most prominent part of the Adam's apple is in an area where the vocal cords attach. It's called the anterior commissure. And if you think of your vocal cords as a guitar string, you want the guitar string to be nice and tight. You don't want it to be floppy and loose because it won't create a nice note. So your vocal cords need to remain tight to function properly, to not have hoarseness. So if that anterior commissure gets disrupted, if you remove the cartilage right in front of the anterior commissure, you will have permanent voice change really for the rest of your life, because that is a very difficult problem to treat. There are some laryngologists that will try different things like anterior commissure tightening or injections that can possibly help, but it's a very difficult problem. So the main thing we want to do is prevent that from happening. So my particular technique in surgery involves using a laryngoscope, a camera that I put through your breathing tube at the time of surgery, and that gives me a bird's eye view of your vocal cords. So I'm able to determine exactly where that point is, where your anterior commissure is, and remove all the cartilage above it. And that means that you may still have some cartilage that forms a little prominence of an Adam's apple, but I've removed as much cartilage as possible while remaining safe for your voice. And that brings me to my last potential, I guess you would say, complication, meaning you still have some prominence of your Adam's apple. And like I said, I'm only going to take off enough cartilage to make it nice and safe for you and your voice. And so if you have a very strong Adam's apple, that may mean that you still have a little bit of prominence there, even though it's less than what it was before. I do see this some in those that are really thin, like meaning they don't have a lot of fat around their neck. If you don't have a lot of fat in your neck, you don't have much to cushion the area around the cartilage. And so I can do things like fat injection or even some biostimulating filler like hyperdilute radius to try to build up the collagen and volume in the neck to try to camouflage that prominence. That's a very difficult problem that no one's able to completely solve for among those of us surgeons that do this procedure a lot. But we're always trying to come up with more techniques. In my hands, I've gotten the best results by doing fat injection in that area. I hope this helps. A tracheal shave procedure is very rewarding and very straightforward for me to do, and the potential complications are rare, but not unheard of. So if you have any other questions for me, please leave a comment below, and don't forget to subscribe for our channel for more helpful information.